Well, good evening, everyone. I am Dr. Prem Shankar, uh, Senior uh, Consultant, AVPR of Specialty Clinic. Today, I am going to discuss about the topic diabetes retinopathy. Um, Diabetes retinopathy is one of the major cause for loss of vision and blindness in the present era. So let us see what is diabetes retinopathy, its importance, its manifestation, and how to prevent it, and Ayurvedic management of diabetes retinopathy. So let us discuss about the importance of diabetes retinopathy. So this is one of the main complication of diabetes that can affect the uh, vision and even blindness. So nowadays, the number of patients or the prevalence of diabetes retinopathy increases due to the large scale of blindness. So um, this is one of the leading cause for the blindness. And another importance that most of the cases, there are asymptomatic conditions. So the first phase may be left unnoticed by the patients, and the later phases, it is end up with the vision loss. And as we have mentioned, the global prevalence of diabetes increases, and it is also reflecting in the increase in the prevalence of diabetes retinopathy. So around 15 to 25 percentage of diabetic patients are getting affected with diabetes retinopathy, and through which the blindness and vision loss. And let us see the manifestation of diabetic retinopathy. So, the increased or the chronic diabetic patients, due to their increased blood sugar level or the hyperglycemia, affect the retina. Retina is otherwise the light reflecting area of the eye, or the area essential for the vision. And um, what happens when there is a increased blood sugar for longer duration? It affect the capillaries or the minute blood vessels on the retina, and that blood vessels eventually getting blocked, or it is becoming fragile, and the later phases goes to the degeneration of the retina due to poor oxygenated blood supply. And the physiology of the retina is getting affected gradually, or a sudden loss of vision also can happen. It can lead to dreadful vision loss. So let us discuss regarding the stages of diabetes retinopathy or the classifications. So, in general, it is considered as the first stages, or the beginning of diabetic retinopathy is known as NPDR. That is otherwise non-proliferative diabetes retinopathy stage, where the most of the cases are seen asymptomatic, and uh, they may not have any particular classical symptoms of diabetes retinopathy. Here, what happens is the microaneurysms happens, or which the minute blood vessels are getting affected, and leakages happens on the capillary end of the blood vessels. So, in such cases, the surface of the retina or the blood vessels are forming a kind of dot blot formation, or else cotton wool formation. In such cases, it is able to understand only through a thorough checkup or a general eye checkup from your eye physician. And then when coming towards the next stage or the stage two, it is known as PDR phase or known as proliferative diabetic retinopathy phase. Here, the fragile blood vessels oozing the blood and it can lead to even blindness, or this is the most advanced condition of diabetic retinopathy if left untreated or if not properly taken care uh, about the glycemic control. And another one condition is called as diabetic macular edema. This is otherwise known as the retina structure is developing a kind of swelling or the collection of fluid between the multiple layers of the retina. So this is another one complication and can lead to most advanced condition of the diabetic retinopathy. So let us see what are the risk factors or the what can lead to the progression of the retinopathy condition. So the longer duration of the diabetes can lead to the complicated diabetic retinopathy and the poor glycemic control, also one of the risk factors in diabetic retinopathy, along with the other systemic conditions. Likewise, high cholesterol or high lipidemia or uh, any hypertension. I mean the hypertension or the systemic hypertension and also the kidney diseases or the nephropathies also can lead to sudden changes in the stages of diabetes retinopathy. And other habits, other lifestyle habits like smoking, alcohol, all that can lead to changes, make changes in the increase in diabetic retinopathy. Also, the obesity, one of the other major reason for uh, uh, complications in diabetic retinopathy. So, let us see what are the clinical features normally seen in a diabetic retinopathy patients. For example, some of the cases may be asymptomatic, likewise, we have already mentioned. But when it is coming towards a symptomatic phase, like blurred vision, one of the common cause or one of the common symptoms can present in diabetic retinopathy, and also another condition known as floaters. Floaters, otherwise, there will be a feeling of kind of flies in their visual field or any kind of flashes in their visual field. That is another one common symptoms in diabetic retinopathy. And another one symptom is known as scotoma. Scotoma, or otherwise, the person will have a kind of a feeling like a dark patches in their visual field that may be moving or maybe stagnated somewhere. That kind of feeling uh, may feel in diabetic retinopathy. And also in most advanced cases, if the diabetic retinopathy affecting the vision area or color vision identification area, it can even affect the color vision, or the person may not be able to identify certain colors. And also, the another most common complication or the most advanced complication known as retinal detachment. So, in most chronic cases, due to heavy bleeding in the retina or the retina surface or the capillary bleeding can lead to the weakness of the retinal surface, and the retina can be displaced from the position and it can be end up with even blindness. So these are the common symptoms or the common classical symptoms represents in a diabetic retinopathy. So let us see towards the clinical aspect, like a diagnostic aspect. So how a doctor will detect your diabetic retinopathy. So in an eye clinic, normally when you visit an eye clinic, the doctor will evaluate your visual acuity test, or this is the baseline examination for the vision that will check your capability of vision to evaluate. So you will be given with a visual acuity chart that is known as Snellen's vision chart will be kept in the clinic, and it will be evaluated. And another methods known as dilated eye examination. So in dilated eye examination, the doctor will be visualizing the retina completely with equipments like ophthalmoscope or slit lamp, and may be able to, or the doctor will evaluate the bleeding areas, and when there is some changes or degenerative conditions on the retina. And another techniques known as uh, imagining of the retina. Likewise, the most advanced condition is known as OCTs, optical coherent tomography, that which evaluate the thickness of the retina, the strength of the retina, or the bleeding that which represents in the retina, and so on. And another one test is known as angiogram, fluorescent angiography. In that test, we'll be evaluating the uh, clots or block on the minute blood vessels. It is also possible to have blocks or kind of occlusions on the retinal capillaries, and this continuous occlusion can lead to lack of oxygenated blood supply on the retinal surface, and gradually the degeneration happens, or the ischemic changes happens on the retinal surface. So these are the sequence happening from the first stages to the most advanced stages. And when coming towards the Ayurvedic approaches, it is known as the complication of prameha or madhumeha. In Ayurveda also, it is known as the complication of diabetic conditions. In Ayurveda, madhumeha or prameha can lead to the upadrava or complication of eye diseases. Likewise, Pramehajanya Netra Roga. In diabetic retinopathy can be compared with Pramehajanya Netra Roga in Ayurveda. So, coming towards the Ayurvedic management, the first line of treatment will be the good glycemic control. So, coming towards the management, the first line will be with the help of Ayurvedic medicaments that will manage, or that will help to control your blood sugar level. So, with an Ayurvedic expert, you can start having Ayurvedic medicine after evaluation. And glycemic control will be the first line of treatment in diabetic retinopathy also. And the other medicaments like Ayurvedic eye drops that will reduce the internal bleeding inside the retina, and internal medicine that will support the retinal structures, or the blood vessels inside the retina, along with the measures like Panchakarma techniques normally used to treat in the neurological conditions or degenerative conditions. The same line of treatment applicable in diabetes retinopathy also. So here, what we are doing to what we are following that to control the diabetic, first will be given the diabetic controlling measures, then the Panchakarma techniques to have a purificatory or Shodhana Chikitsa. According to Ayurveda, it is known as Shodhana Chikitsa or purification will be given. Normally, in diabetic cases or diabetic retinopathy cases, Ayurveda, the first line of purification is to give Virajana or purgation therapy will be given with a cloth monitor on your blood sugar level. So, a certain extent, it will allow to reduce the bleeding, as well as to reduce the internal swelling on the retinal surface, and followed by a group of specialized eye therapies known as Netra Kriya Kalpas. So these are personalized group of eye therapies to improve the vision naturally, as well as to protect the anatomical structures inside the eye. So the multiple layers of eyes are classical divided into Ayurvedic science also. Particular type of treatment from the Netra Kriya Kalpa. Around seven types of Kriya Kalpas are mentioned in Ayurveda. So, after a complete evaluation, the experts will decide which Kriya Kalpa or which therapy will be suitable for that particular patient in that condition. So, that will be start applying in each stage of management and in a regular interval. It can be a couple of weeks or even a month. Um, the close monitoring of the patient, along with the blood sugar level monitoring and examination of the vision, as well as the other anatomical structures. So these are the basic things what followed by Ayurveda in the management of diabetic retinopathy. Along with these medications and therapies, the other lifestyle uh, management or the lifestyle changes also advised to the patient in terms of diet. So, diabetic patients will be advised to follow particular diet that will compact towards the diabetic retinopathy patients also, and proper exercise in terms there are some difference opinion in terms of exercise here. Due to this capillary bleeding, the diabetic retinopathy happens. So when the person advised with an exercise, the rigorous movements or the excessive exercise also restricted. Meanwhile, the simple exercise like walking or kind of meditation, such things can be advised. But that severe exercise like bending down postures or excessive kind of weight lifting, all that are restricted in diabetic retinopathy because the capillary bleeding can increase further, and it can lead to the diabetic retinopathy can enter to the second phase or the advanced phases. So these are the basic things what following in the management of diabetic retinopathy. And while coming towards the other things like a person, if a person already diagnosed to have a diabetic eye disease or diabetic retinopathy, close monitoring are required. That means in a regular interval, at least every 6 months once, the person advised to have a general routine eye checkup or whenever it requires. Likewise, we have discussed about the uh, main symptoms or the classical symptoms in diabetic retinopathy. If any of these symptoms are felt, or if any changes happens in your vision, immediately you have to consult with the expert and seek the possibilities. So, these are the some of the detailing regarding the diabetic retinopathy. I hope you all could get some information, and thanks for your patience. Thank you so much.